Medicare Explained, Medicare Made Easy, Medicare Made Clear. No matter how we word it in the title of all of these videos that you're watching, understanding Medicare is not always easy. I know that, and I hope to solve that with this video. In this video, I'm going to help you learn about Medicare explained in an easy-to-follow format. Medicare will be made clear to you. You'll understand how Medicare works. You'll understand about Medicare Part A and about Medicare Part B and the choices that you have to make once you've signed up for Medicare Parts A and Part B. Once you've signed up for Medicare Part A and Part B, you will have to make one of three choices. We're going to go over each of those choices, the pros and the cons of each, so that you can make an informed decision once you've signed up for Medicare. Stay tuned. Hi, I'm Matthew Clausen with MedigapSeminars.org. I don't intend for this to be a long, boring video. Medicare explained properly can make understanding Medicare easy and can be done in under 30 minutes. That's my goal for this video. Once you understand the basics of Medicare Part A and B, you will be faced with taking one of three paths with your Medicare. Now, this can be one of the most important decisions that you make in Medicare. It will set you on a course that will impact the quality of the medical care that you get, and it could potentially be irreversible. To keep this video brief, I have done a separate video on how, when, and where to sign up for Medicare. So if you haven't signed up for Medicare yet and you would like to learn that first, I've linked it in the upper right of this video. There's a white circle with an I. You can click on that and go to the How to Sign Up for Medicare video. I will also have that linked at the very end of this video in the last 30 seconds when we link some videos on the screen for you. First up in this Medicare Explained video is terminology. Often when people start to learn about Medicare, they trip up on the terminology. Often it's common insurance terminology. So we're going to cover this first very briefly. The first terms that you should be familiar with are a deductible, a copay, and coinsurance. The deductible is the amount of money that you have to pay first before your insurance kicks in. A copay is a portion of the bill that you pay after you pay the deductible. You'll pay the copay up front, often when you have the service itself, and a copay is always in a dollar amount. For example, if you pay $20 every time you see a doctor, that's a copay. Coinsurance is like a copay, but it refers to a percentage. It's a percentage of the bill that you, the consumer, have to pay. So putting all of this together, if you have a $200 deductible, a $20 copay, and a 20% coinsurance, it means that you're going to pay the first $200 in services. That is your deductible. Then, if you're seeing a doctor, it's a $20 copay. You pay that $20 on the office visit. And if you have a 20% coinsurance, it means that when you receive the bill, after you've paid the deductible and the copay, you're going to pay 20% of the remaining bill. It's very common for people to confuse a deductible and a premium. So the premium is also an important term to understand. With your Medicare Part B, we'll get into in a moment, you have a premium. A premium is a monthly fee. It's your monthly cost to purchase the insurance. The deductible is something that is paid when you use the insurance. The premium is what you pay to have the insurance. It's important to understand this terminology, but don't get lost in the details of copays and deductibles and coinsurance. As I mentioned earlier, and we're going to get into detail here in just a bit, you're going to have to make one of three choices. Well, in two of those three choices, the deductibles, copay, and coinsurance that you have in your Medicare U Guidebook are rendered moot. In two of those three choices, you do not need to understand those specific copays and deductibles. So don't get lost in them. Understand the big picture as we're going to present here. With terminology out of the way, next in this Medicare Explained video is Medicare Part A and Medicare Part B. Medicare Part A is that portion of your health insurance that covers you when you are an inpatient. As soon as you are registered as an inpatient in a hospital or in a nursing facility or a hospice, Medicare Part A takes over. So think of Medicare Part A as inpatient services. Now, whenever you are an inpatient in a hospital, in a nursing facility, or in a hospice, that's your Medicare Part A. And also, the one exception is if you're physically not able to get to a hospital or a medical facility, Part A also covers your in-home health care. For most of us, we've paid for our Medicare Part A with a payroll tax. That's that 1.45% payroll tax that comes out of your paycheck, every paycheck when you're working. That covers Medicare Part A. As long as you have paid that tax, or I should say as long as you or your spouse have paid that tax for at least 10 years, then Medicare Part A has no cost for you. If neither you or your spouse had paid for that tax for 10 years, then you can get Medicare Part A, but it will cost you a monthly premium. So for most of us, Medicare Part A is already paid for. Now let's talk about Medicare Part B. Medicare Part B is your outpatient and physician services. If you're not an inpatient, obviously you're an outpatient, and that is your Medicare Part B health insurance coverage. So Medicare Part B is the insurance you use when you see a doctor, when you have a lab test, or when you have your wellness services. Medicare Part B is that part of your healthcare that people use most often. It's whenever you see a doctor outside the hospital, and even many of the hospital services and surgeries are now done on an outpatient basis, which would then mean they're covered under Part B. Everyone has to pay for your Medicare Part B. You have to pay a premium for it. And everyone needs a Part B unless you already have and are continuing with employer health insurance coverage and your employer has 20 or more employees. So absent that, you will need Medicare Part B and you're going to need to pay for it. How much you pay for your Medicare Part B depends on your adjusted gross income as of 2 years ago, and it's going to depend on when you start your Medicare Part B as well. In 2018, if your adjusted gross income 2 years ago was $85,000 or less if you file individually, or $170,000 or less if you file jointly, then your Medicare Part B premium was $134 a month. If your income was higher, your payments towards Medicare Part B are also going to be higher. To find out exactly what it's going to be for you in the year that you're watching this video, simply go to Medicare.gov, the Medicare website, and in the search bar type in the cost of Medicare Part B. And that will tell you what you're going to pay for your Medicare Part B. And it's also called an income adjustment. And just as an FYI, the same income adjustment that you have if you are eligible for it for your Medicare Part B will also impact your prescription drug costs, your Medicare Part D prescription drug premium. In my previous video on how to sign up for Medicare, I also covered how and when you can qualify for delaying your Medicare Part B. So please see that video, how to sign up for Medicare, for those details. So to recap, Medicare Part A is your inpatient hospital coverage. It's going to cover you if you're admitted as an inpatient in a hospital, in a nursing facility, or in a hospice, or if you can't make it to one of those facilities and you need in-home health care, Medicare Part A covers that as well. Medicare Part B is outpatient services and physician services. That's the part of Medicare that you're going to use most often. And it covers you when you see the doctor, it covers you for your lab tests, and all of the other outpatient services. Together, Medicare Part A and Medicare Part B are called Original Medicare. That's an important term that you should understand because we're going to see it several times here in this video. Original Medicare is Medicare Part A and Medicare Part B combined. That's the pillar, it's the foundation of Medicare. Your original Medicare, Medicare Part A and B, is good in any state, in any territory, anywhere in the country. You can see any doctor, you can go to any medical facility as long as they accept Medicare. You don't have to ask permission to see a specialist. You have control over your health care and you have freedom. And that's if you have Medicare Part A and Medicare Part B. Both Medicare Part A and Medicare Part B have copays and deductibles. In addition to that, your Medicare Part B also has a coinsurance. It has a 20% coinsurance, and that means that after you've paid the deductible and after your copays, you still have to pay 20% of whatever the remaining portion of the bill is. Rather than go through all the details of there's this deductible and this copay, understand the big picture here, that you're going to have to make one of three choices. Now, in two of those three choices, you're not going to have to know the specific copays and deductibles in your Medicare and You guidebook. But no matter what choice you make, you will have to still pay for your Medicare Part B. Your Medicare Part B premium will be there for you no matter what choice you make. So next in this Medicare Explained video are your choices. What are your three choices? The first choice, do nothing. Just have your Medicare Part A and your Medicare Part B. Now, this is the only choice that you make that it's going to be important to understand all the details on those copays and deductibles. And you're going to find when you look into them that there is no maximum annual out-of-pocket limit. You are at substantial financial risk if you get ill. Original Medicare, Medicare Part A and B alone, it was never meant to be your entire insurance. Still, it's a choice some people make, and it's a choice you can make if you wish. Your next choice, choice number 2, is to trade in your Medicare Part A and Medicare Part B for a Medicare Advantage plan. Now, Medicare Advantage plans, most people know as the HMOs and the PPOs of Medicare. They're also called Medicare Part C. Medicare Part C, or Medicare Advantage plan, replaces Medicare Part A and Part B. So you are replacing the copays and the deductibles of Medicare Part A and B with the copays and the deductibles of a private for-profit insurance company. So with Medicare Part C, or Medicare Advantage plans, you still have copays, you still have deductibles, you still have coinsurance. It's just not the same copays, coinsurance that you have with Original Medicare. It's not less either, but it's just not the same. So instead of understanding the copays and deductibles in your Medicare and You guidebook, you will need to understand those that are provided to you by the insurance company that you choose to work with. I have an entire video on the details of Medicare Advantage plans, but here are some of the pros and cons that you should consider. First, Medicare Advantage plans are not enhanced Medicare. In fact, by rules or regulations, a Medicare Advantage plan is designed to be actuarially equivalent to just having Medicare A and Medicare B. What's that mean, actuarially equivalent? Well, it means that with all the people on the plan, half of the people on the plan are going to pay less for their health care than if they had just Medicare A and B. Half of the people are going to pay more for their health care than if they had just Medicare A and B. Your experience is going to be different from one person to another, and it's going to depend entirely on your health needs. Now, on the positive side is many of these Medicare Advantage plans have zero premium. As a matter of fact, in the southern half of the states, they're often sold as zero premium Medicare. That's a little bit deceptive. The truth is, you're not paying any different if you have a zero premium plan than as if you had Original Medicare, and you're getting an actuarial equivalent. So it's not that you're getting enhanced coverage, and they'll throw in something like dental or vision. Be very careful with that. Often these are extremely limited dental or vision care that you could replace with $10 a month elsewhere. So be very careful. It's not enhanced Medicare coverage. So what's going on? What's going on with what is this Medicare Advantage all about? I mentioned with original Medicare that you have complete freedom and control. You can see any doctor anywhere in the country, and you can decide who you want to go with. Well, with Medicare Advantage plans, you're giving up that freedom and you're giving up that control for a maximum annual out-of-pocket. Original Medicare has no maximum out-of-pocket. You can be completely exposed financially. A Medicare Advantage plan sets a limit. Now, it might be a high limit, but it sets a limit on how much money you are exposed to on an annual basis. So that's the trade-off. You have to weigh for yourself whether or not it's worth it for you, but you should also consider all three of your choices before you make that decision. Medicare Advantage plans will often also include a bundled prescription drug plan, a bundled Part D plan. That could be a good thing if you have no or very few prescription drugs that you're taking, because it might save you that $20 premium that you would have to pay for a prescription drug plan. However, if you have a lot of prescription drug plans, that is really what you want to look at, because you could end up paying more for your prescription drugs with a Medicare Advantage plan than if you were able to shop for your own prescription drug plan, as we show in my other videos. So this is very important. You are not allowed to have your own standalone prescription drug plan when you have a Medicare Advantage HMO or PPO. It's very important. If you were to go and get a standalone prescription drug plan, Medicare will actually cancel your HMO or PPO, cancel your Medicare Advantage plan. You cannot have both. You have to take the prescription drug plan that's bundled with your Medicare Advantage plan. It's also important to understand that Medicare Advantage plans are local coverage. Talk about trade-off on choice. With original Medicare, if there's a specialist you want to go see in Texas and you're in New York, you can do that. When you have a Medicare Advantage plan, you can't. You have a local network that you typically have to stay within. It's local coverage. If you are a snowbird and you live in, 3 different states, that should rule out a Medicare Advantage plan as it is. Or if you're an RVer and you like to travel, that too should rule out a Medicare Advantage plan. So if you have a Medicare Advantage HMO or PPO, you're going to have a network, a select group of doctors that you are supposed to see. If you have an HMO, you can't go out of that network without paying 100% of the medical cost yourself. So other than an emergency, with an HMO outside of the network, it's on you. With a PPO, you can still see other doctors in Medicare, other doctors that accept Medicare anywhere in the country, but it's going to cost you more. In some cases, that cost can be prohibitive. Lastly, Medicare Advantage plans change every year. Anything about these plans can change. Your doctor may not be on it next year. Your hospitals can change, the co-pays, the deductibles, the drug coverage. Every feature of a Medicare Advantage plan can change each and every year. That's why there is the annual election period. Some people call it open enrollment. It's technically annual election period, and that's from October 15th through December 7th of each year. During that time period, you can look at the plans that are available to you as they are for the year ahead and select which one you want. You can keep the plan you have. You can select a new one. Those are your options. But remember, you have to do that each and every year because the plans will change each and every year. And you should notice as you're shopping through Medicare Advantage plans that Medicare gives them a star rating. It's from a low of 1 to a high of 5. And that star rating is important. That tells you how they have been rated by other users, other people in Medicare, how they've been rated on how they treat you. So that's very important, and we're going to get more into that in a second when we talk actually about a different subject. But when you're evaluating Medicare Advantage plans, that star rating is an important indicator. So to recap your first two choices, first there's do nothing, just have Medicare A and B, original Medicare. You have the freedom to see any doctor in the country, you have control over your health care, but you do not have a financial cap. You don't have a cap on your financial exposure. Choice number two is to trade that in for the actuarial equivalency run by a private for-profit insurance company. You're going to give up your freedom and your control over your health care, but you're going to have a limit financially. You will have a maximum annual out-of-pocket limit so that your financial exposure is capped on an annual basis. Your third choice is to keep your original Medicare. Keep your Medicare A and B and add to that, enhance it with a Medicare supplement. That Medicare supplement will then pay the co-pays and the deductibles that would be left as your financial responsibility. With a Medicare supplement plan, you can limit your annual out-of-pocket expense for medical bills to zero or just a couple $100s. Medicare supplement plans are also called Medigap plans. Same thing, Medicare supplement, Medigap. Medicare supplement plans are subservient to Medicare. So Medicare supplement plans are administered by a private insurance company, but they are subservient to Medicare. And here's how it works. You go to the doctor will bill Medicare. Medicare pays its portion, then Medicare will instruct the Medicare supplement company what to pay and when to pay it by. There's no debate, there's no argument, there's nothing the Medicare supplement plan can do to avoid paying something. And it will never be really something that you even look at. Medicare is the middle person so that you're never having to deal with the insurance company other than paying your premiums and telling them when you've moved. So Medicare supplement plans, it's very important to understand, it's completely different than a Medicare Advantage plan. They are subservient to Medicare and they pay the claims Medicare tells them to pay. There are no star ratings with Medicare supplement plans, and that's important to understand. It's an important distinction. Why are there no star ratings? Well, there are no star ratings with the supplement plan because your experience with the supplement plan is actually your experience with Medicare. It's original Medicare making those decisions, not the insurance company. The benefits of a Medicare supplement plan are standardized. They're meant to be exactly the same from one company to another. In fact, those benefits are written into Social Security law. There are 10 different Medicare supplement plans. They're each designated by letter. There's the most commons are Plan F, a Plan G, a Plan N, Plan C, etc. Each and every one of those plans, if it's a Plan G, it's identical from one company to another. Plan N's identical from one company to another because the benefits of those plans are written into law to be exact, to be identical. The only difference is your price and the pricing strategy of the insurance company. With a Medicare supplement plan, you still have original Medicare, so you can still see any doctor, go to any medical facility in the country. You don't have to get permission. You have complete freedom. You have complete control over your health care. And now you have a financial maximum annual out-of-pocket that can be limited to down to zero or just a couple $100s a year. It's also important to understand that when you have a Medicare supplement, you don't need to ask your doctor, do they take insurance X? All your doctor or hospital has to do is take Medicare. It doesn't matter which insurance company that you have your supplement plan with, as long as they take Medicare, they take the supplement. So the easy way to word that is every doctor and every hospital that accepts Medicare accepts every Medicare supplement from any insurance company. Medicare supplement plans have their own premium. They have their own cost separate from Medicare. For most people, they find that the cost of a Medicare supplement is substantially less than their under 65 Medicare that they had been paying for. And when you have a Medicare supplement, you have original Medicare, you also will need to get your own separate standalone prescription drug plan. For some people, that will be a good thing, because when you can shop for your own prescription drug plan, you will often save money over some of the alternatives with Medicare Advantage plans. As long as the cost of a Medicare supplement can fit into your budget, the Medicare supplement and original Medicare is some of the best health care that's available in this country. Now, this is very important. In virtually every state in this country, it's all but a few states, there's only a 6-month window that you have where you can get the Medicare supplement plan of your choice without having to go through medical underwriting. Now, you should be by now aware of your Medicare initial enrollment period. There is also a Medicare supplement initial enrollment period. It's a separate period. Your Medicare supplement initial enrollment period starts the day that you start your Medicare Part B and extends for 6 months. So it's a 6-month window where the very first 6 months that you have Medicare Part B, you can get any Medicare supplement plan available to you at the best price that that plan is offered. After that 6-month period, you can still shop for a Medicare supplement plan, but in order to get one, you'll have to qualify medically. To qualify medically, we'll take a look at your medical history and your prescriptions, and if you've had any significant history, recent histories of heart attack, stroke, cancer, dementia, very significant events, then you may not be able to get a Medicare supplement. This is something that I've seen all too often. People going with a Medicare Advantage plan thinking, well, they're just going to save money because they're healthy anyway. A couple years go by, something happens, and now they're looking at all the costs that are associated with their health care and a Medicare Advantage plan, and they'd rather have a supplement. So they call me up during the Medicare annual enrollment period and they want to get a Medicare supplement, but they can't. They can't because their health history is now tainted and they are unable to qualify medically. And that's important to understand. The annual election period, your annual open enrollment for Medicare, is only for Medicare Advantage plans and prescription drug plans. Your Medicare supplement has no annual enrollment. It doesn't change every year, so you don't need one. After your first 6 months on Medicare, you can still change your plan anytime. You can change it as often as you want. You just have to qualify medically. And if you can't qualify medically, then you will be unable to get a Medicare supplement plan. So to put it simply, you can always switch from a Medicare supplement to a Medicare Advantage plan, but you can't always switch from a Medicare Advantage plan to a Medicare supplement. So to recap your 3 choices, you can simply keep your original Medicare. You have freedom, you have control, but you have unlimited financial exposure. You can switch to a Medicare Advantage plan where you give up your freedom and your control, but you have limited financial exposure. Or you can build on your original Medicare, add a Medicare supplement to it. You're going to pay an extra expense for that, but you maintain your freedom to see any doctor anywhere in the country. You maintain your control to be able to go to the doctor at your will and not have to get permission. And you've limited your financial exposure to much less than you would with a Medicare Advantage plan. So the next step is when you decide which of these 3 roles or areas that you want to take a look at. If you want to explore Medicare Advantage plans, at the very end of this video, in the last 30 seconds of this video, there's a link to some of the other videos that you should see, and one of them would be to the Medicare Advantage plan. I'll also have links to some specific Medicare supplements, the more common ones, so you can see videos on those as well. Again, it's in the last 30 seconds of this video. Lastly, we have not covered Medicare Part D prescription drug plans. Well, rather than drag this video on to a point where it puts everybody to sleep, I have everything that you need to know about prescription drug plans in 2 separate videos. The first being Medicare Part D Explained, which talks about the plans, the features of the plans that you should be aware of when deciding or shopping for a plan. The second one is how to shop for a prescription drug plan. And in that one, I actually take you step by step on how to get on the Medicare.gov site, input your prescriptions, and let the Medicare.gov website show you which Medicare Part D plan is going to be best for you. In those videos, I also tell you why you should never take the recommendation for which Medicare Part D plan to get from an agent or broker. Never ask the agent or broker which Part D plan, which prescription drug plan should I get. Always use the Medicare.gov website to figure out which plan is right for you, and explain why in those videos. And that too is going to be linked here in just a second at the very end of this video. I hope you found this video helpful and enjoyed our Medicare Explained video. If you did, please give it a thumbs up. When you do, you're actually signaling to YouTube that, hey, this is a good video, and when other people searching for a Medicare Explained video, they're going to find this one too, and it really does help. And if you subscribe to my channel, you're going to be able to find all of my videos on Medicare very easily, just there on my channel under a New to Medicare playlist, and I also have an All About Medicare playlist. But now it's your turn. I make these videos for you, and it's important for me to understand what you liked or didn't like about the video. Leave me a comment below. Let me know, please, what it is that you liked about the video, what it is you didn't like. It's going to help me to make other videos that will be more beneficial to you. And if you have a question, I want to hear from you. I really want to know what you have to say. Leave it in the comments section below and I will answer it. I'm Matthew Clausen at MedigapSeminars.org. Thank you for watching.